about autism spectrum disorder, and this video was released on 2nd April 2021, as this is a day that is being called as Autism Awareness Day, which is internationally recognized by United Nations to create awareness among the public about autism. So people should get to know what is autism, to accept autism. People should be ready to accept autism and create an inclusivity among us for persons with autism spectrum disorder. So this is an awareness video about what is autism spectrum disorder, what are the signs and symptoms of autism spectrum disorder, and what are the remedies that are related to autism spectrum disorder. Let's get into the video. Autism or autism spectrum disorder is something which is now more commonly heard among school teachers, parents or neighbors and all that. So what does it actually mean? Autism and autism spectrum disorder, are these both same? There are like lots of confusion that is running around your mind about autism spectrum disorder. So let me clarify from that point. Okay, so when I say autism spectrum disorder, it was initially called as autism. Okay, but now due to the recent edition or the recent revisions, it is called as autism spectrum disorder. So we refer DSM-5, that is Diagnostic Statistic Manual of Mental Disorders. So that's a manual that psychologists and psychiatrists refer for any kind of psychiatric illness or mental disorders or any other disorder. So according to that, at the present time, we call autism as autism spectrum disorder. So it's called a spectrum because autism itself has lots of variants in it. They have different types, there are different levels that are being associated. But earlier when you say there were different disorders that has been classified as like autism, and you have Rett's disorder, you had Asperger's disorder. So these were the earlier classification. But this time what happened was they had clubbed all together and that is being arranged in a spectrum. That is why we call it as autism spectrum disorder. And in autism spectrum disorder, you can actually see there are like different levels of it, the range it goes. When I say according to DSM-5, you have a mild, moderate and severe range. So this is based on the severity and the kind of support that needs to be given for people with autism spectrum disorder. Like for example, people with autism at a milder level may or may not be verbal, but mostly they would be on the verbal side, and they would have the communication, better communication skills rather than the other two categories, and it is almost similar to that of normalcy. Sorry, the so-called normalcy I would say, but but still they do have difficulty in meaningful communications, and they have significant challenge in communications and social interaction. Whereas from there, if I move on to the moderate level, it is more of it can be either verbal or non-verbal, and more of support is needed at this category. Okay, so they have more challenges when compared to that of mild level, and they need more and more support and interventions to bridge their gaps or minimize their challenges. And moving on to the severity level, so it may or may not be persons with intellectual disability, okay, and they would need more support in compared to mild and moderate level, and they do have difficulties or challenges in the area of communication and language. So these are the three variants or three range that falls under the spectrum. So when I talk about autism spectrum disorder, what is it? So where is it coming from? Where is the origin? What is the cause of it? So autism is basically a neurobiological condition. I would not call it as disease, and it is most rightly called as a condition because this is due to the different pattern of neural wiring that has happened inside the brain of that particular individual. So people with autism have a different wiring or different neural connections that is happening in their brain, and as a result of it, they have a different pattern of expressing, communication and understanding. So they have a different experience of the real world. their communication patterns are aligned in a different way rather when compared to that of so-called normalcy. So when I say so-called normal or normal, that means it is according to the social, also called as neurodiverse population. Okay, they have a different way of experiencing things. So, and when I move on to the cause, I would say the cause of autism is still unknown. Okay, the researchers are going on and all that is happening, but we are not still able to find out the exact root cause of autism spectrum disorders. And the same way, it is also not curable. Definitely, we can decrease the condition of the condition or the degree of disorder, but definitely there is no exact cure as such. You can minimize the challenges by giving training for lots of skills according to the level of the child. So when I talk about developing skills or reducing challenges, that is done through a series of different interventions that are going to be associated with the child's current level. So what are the different therapies that are being associated? So I know this is one of the important topic, but before that I will handle this at the end of it. Before that, I would like to take you through autism once more in detail before I go over the remedial part. So yeah, I wanted to talk about remedial and the intervention part. Before that, what does autism would look like? Okay, so autism spectrum disorder, as I said, it is rightly called a spectrum because there are lots of variants and types and levels involved in it. So autism spectrum disorder has mainly three domains that the people get affected in these three domains. First one is the social. The child would have difficulties in the social interaction, so they will not be able to make relationships, they will not be able to communicate with each other, they will not be able to interact with each other. So when you compare the other kids, they should be able to draw their attention on, gain their attention and all that, but this child would be mostly isolated and they would be involved in their own actions, and the connection between people, the social interaction might be the difficult component for them. And the second area is the communication part. So this can be both verbal and non-verbal communication. It can be either. Okay, so as I said, the social interaction is, it has been affected. Definitely, the child would also have a difficulty in the communication part. And the third one would be the restrictive or repetitive behavior, which we call the stereotypical behavior. The child might be keep on engaging in some kind of self-stimulating behavior, such as hand flapping, rotating, or spinning around, or they might be involved in some kind of self-stimulating behavior. So these are the three main domains, I would say, which would help us to identify that the child is having a spectrum, or the child is falling under spectrum. So these are the main domains. So how do you identify it? So as a parent, as a teacher, there are like lots of things that you observe in child every day. Okay, but usually when it comes to the diagnosis, it happens in the age of 1 or 2, because at the age of 1 or 2 you find that the child is not speaking according to the his age, or else he is not talking according to how his brother started talking, how his sister started talking, but my child is not talking like that. His sibling was talking more at this age, his cousin was to his cousin, his peer, his friends, my neighbor kid. So all of them started talking, but this child, though his age is more or something, he is not able to talk much. So that is something as considered as a red flag when the child is not able to express himself. The speech is not developed according to their age factor, and the child is mostly detached from the environment. It's sent to play parallelly. They don't play together with kids. Instead, they have their own set of toys and they keep playing with their own toys parallelly. And they might also engage in behavior like looking at one side of an object or one side. They just try to, their eyeballs used to be cornered to one side and they would keep on looking or stimming on their sides. Okay, and they might be preoccupied, or they might be liking about circular motions, either a toy that is being completely every time spinning, or the tires of vehicle that is being spinning, and they just love to see and watch that. And the expressive part, they might be overly emotional, they may cry a lot, they might not be able to control their laugh, they might laugh loudly, all that would happen. And repetitive behaviors might be observed. And usually at the age of 10 months or so, the kids might not be comfortable with everybody. There is a separation anxiety, something that called is being stepped in when the child is 9 months, because the child might feel, okay, I'm not with my mom or parent, so I'm not comfortable with them. They might have a small separation anxiety, I would say, anxious level. But kids with autism usually don't have that. They might be comfortable with going with others, or they might not completely because they are more occupied with their own self. So the speech milestones might also be affected. So these are some of the general red flags that you can look for. So people with autism spectrum disorder would have their skills, the developmental milestones that has been hampered in different areas of milestones. Like it can be a physical, it can be social, it can be emotional, and it can be cognitive and speech. So these are the different milestones where you can see kids falling under spectrum would have difficulties with, and the major difficulties would be in the area of speech and language, and then communication and social interaction. So these are the most important components. Okay, now as I said, as you identify this is what my child is going through, and I see this my child is having some difficulties in this case, and I find the child is little different from others, what is the next step that you are supposed to do? Okay, first thing is, please take a help from a professional or an expert in that area. So you can definitely refer, you can go and meet your pediatrician, you can go and meet a psychologist, a clinical psychologist, and get the therapy done at the earliest. Okay, so once you are able to identify that the child is lagging behind somewhere in any of the milestones, it can be a speech, language, social area, whatever it is. Once you identify there is a delay, please take a help of an expert and get him or her into the therapeutic intervention, because earlier the better. The early intervention has numerous benefits. At the age of 1.5, 2, 2.5, 3 years, what happens is your brain is actually fresh and malleable. We call that a concept called neuroplasticity. The brain can be bent on, can be aligned to make different connections at that point of time. The brain, based on the intervention that is being given, the brain neural connections inside the brain change gradually and align themselves to meet the expectancies. Okay, so, and I'm again saying it is not curable, but definitely the condition can be better, and it can be improved, the challenges can be minimized. But all these intervention needs to be very unique and customized to each one's needs and the developmental level. Okay, so let's move on to the remedial. So once you find out this is what my child is going through, please enroll him for any kind of therapies that is needed according to the experts' advice. So some kids might need all of these mentioned therapies, and some might need only few of these therapies that I'm mentioning about. And it depends on each and every child, the level, severity, and the difficulties that is being faced by the child. As I spoke about what is autism, what are the different levels, severities, and variants in autism spectrum disorders, what would be the signs and the major areas that is going to get affected when the child is in spectrum or falls under spectrum, the next point of discussion would be what would be the interventions that are related to persons with autism spectrum disorder. Okay, so we'll start from occupational therapy. So when I say about occupational therapy, these are the activities that is gonna help the persons with autism spectrum disorder to promote and help them in their daily living activities. They might get to know about what is happening in their surroundings, the use of objects that is around them, everyday objects. They would be learning to become more independent. Their motor skills might get developed. So when I say more independent, they might be able to get dressed up on themselves, taking bath all on their own, eating habits. So all that related activities would be dealt in occupational therapy. And whatever that has been involved related to school, work or play will be covered in occupational therapy. And there is also sensory integration therapy, which is actually a form of occupational therapy, I would say, that is more in integrating the different senses of an individual. Like children under spectrum, no, they do have more reactivity to certain sounds or certain kinds of senses. Some might need more of visual sensation, some might need more of auditory sensation. So that's the reason they just keep on engaging in some kind of repetitive behaviors. Okay, they have challenges processing the sight, sound, touch, taste, smell, the body position and balance, and this would impact their daily ability to do their routine activities, like for example brushing teeth, having a dinner at a table, or or taking a break time, or going to a washroom. All that might be a difficulty. So the daily routine might also get difficult because of their sensory challenges. So occupational therapy team with sensory integration would work on all these sensory needs. They would integrate and help the child to understand the boundaries, space, how do they participate in different activities, keeping a safe body, and performing daily living skills like brushing, bathing, dressing, and transitions from school to work, work to school and home, that all that. And feeding, self-feeding, and increasing different variety of food to be eaten, swallowed. So all that areas would be assisted in the occupational area. And the next area would be the speech therapy. So this therapy would help children in speaking and communicating and interacting with others. As I said, this is one of the major domain that has been affected for children with spectrum. Okay, they would have difficulty in not giving a eye contact. They might involve on non-verbal skills. They might have difficulty in taking turns during conversation. They might use gestures, but mostly it would be non-meaningful gestures. So speech therapies would help you to work on all these aspects. So they might help teach kids to express themselves either through pictures, symbols, sign languages, or using vocabularies, words, or all that. So that is what is being done by speech therapists. They articulate the words, they help them to communicate both verbally and non-verbally. They help to understand the other's intentions at different settings. They would initiate communication, help you to initiate communication and develop to work on conversational skills, and this would definitely help them to develop relationships, enjoy child communicating, playing and interacting with peers. All that would happen as a result of speech therapy. And the next area would be the behavior management. So as a child is having difficulty at different levels and different milestones, the child would also have difficulty in some of the behavior that has been accepted. So for that, we do have some behavior therapy and behavior management therapies that has been focused, and you have different variety of it. I'm not gonna take you deep into all those varieties, but just wanted to give you on one or two examples of it. One such evidence-based behavior management strategy is applied behavior analysis. Okay, so this is a therapy which is based on science of learning and behavior. Okay, so how the behavior would work, how is it being affected by the immediate environment, and how is the learning taking place. So this is how the behavior is being understood. Okay, so this therapy program would help the child to increase their language and communication skill. They help you to enhance their focus, attention and social skills in kids, and this would also decrease their problem behavior. So how is it working? So this is being worked based on the reinforcement method. So reinforcing or rewarding the behavior, desirable behavior will help the child to acquire new task. So this is how the ABA would work on. And one other method of behavior management technique approach for autistic children are teach methods. So this has been developed as an integrated approach for children with uh, autism spectrum disorder. So again, this is an evidence based academic program, and it is based on the idea that all autistic kids or autistic individuals are visual learners. So definitely if they are visual learners, they are there should be accommodations and modification done to their learning materials and teaching style. So how was it done? The all the materials that has been presented to them. Okay, so physical stuff, physical structure, that is the immediate surroundings, and the daily activities such as playing, eating, working, all that is being defined by a physical boundaries, and it would be presented through different mediums such as drawings, photographs, all that. So most of the visual visual clues and the visual aids are being added into the approach, and that is how the teach method would work for. And then applied behavior analysis, and we do have social skills training. So this is again it can be either group or one-on-one, and it can start from one-on-one and to move on to group, and this is mainly to improve how a child interacts socially and how is it forming a bond with others. So it's like it can be either through a role play or a practice or by prompting, all that, and this is usually led by a therapist. And parent training and teacher training comes as an important concept in social skills training. And then comes the special education. So it's not just the child is being independent in doing its own activities and carrying out its own daily living routine activities and all that, but the child also should be able to cope with the changes or learn something from the school as well. So that's where the special education comes in for the academic purpose. So the special educators would develop individualized education plan for children with autism spectrum disorder, and they would work on a modified curriculum and modified educational goals depending on the need and the level of the child, and that would be implemented according to different teaching practices and different teaching strategies. Okay, so these are some of the different remedial services that are being provided to children with autism. So when I say about remedial services, I just wanted to highlight that there is no cure for autism, but we are just minimizing the gap or minimizing the challenges that the child is facing. Okay, so this would enhance their independency and to carry out their life with ease. Okay, so definitely the degree of autism can be minimized if the interventions are given at a very earlier phase. So that's all for today's video. I think I had given you a brief idea about what is autism spectrum disorder. There are 3 levels or 3 variants under that, which is mild, moderate and severe based on their difficulty level and this kind of support that is being given to them, and it is a neurodevelopmental and biological condition, and the cause of autism spectrum disorder is yet unknown, but there is no medicine or cure for autism, but definitely the certain features of autism can be kept in control or can be reduced with certain kind of medicines, like for example the attention or the hyperactivity or some kind of sensitivity or some kind of dietary plans, and all that medicines can be given under medical supervision for certain kids for according to their needs, but there is no specific medicine as such for autism spectrum disorder, and the degree with the proper intervention and timely individualized education and therapeutic plans, the degree of autism spectrum disorder can be minimized. So that's all for today's video. Thanks for watching this video. Please do like, share and subscribe our channel for more such videos. Spread the rays.